Welcome, and thank you for watching a special coverage WebEx covering the topic of COVID-19 vaccination at North Central Healthcare. My name is Jarret Nickel, and I'm the Operations Executive at North Central Healthcare, and I'll be leading you through today's WebEx. With me today, I have Ryan Hanson, Director of Nursing at Pinecrest Nursing Home, Scott Van Ermen, Director of Pharmacy Services for North Central Healthcare, and Tim Holzem, Infection Preventionist and Lab Supervisor for North Central Healthcare. I would just want to do a special thank you to the three of you for joining me today and taking time out of your day to provide these details to both staff, residents, and families at North Central Healthcare. I'm going to start this off with a question for Tim Holzem. Tim, big question that's been asked a lot is, what is an mRNA vaccine?
Yeah, an mRNA vaccine, they're a new type of vaccine to protect against infectious diseases. What they do is they trigger an immune response, and many vaccines put a weakened or inactivated germ into our bodies, but mRNA vaccines do not. Instead, they teach our immunity cells how to make a protein or even just a piece of a protein that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. At this time, we're anticipating that we will receive COVID vaccines from Pfizer and Moderna.
So Tim, thank you for the explanation on what type of vaccine we anticipate to receive here at North Central Healthcare. Focusing now on administration, Scott, I'm going to turn it over to you. How is COVID-19 vaccination administered?
So the vaccine for COVID-19 is an intramuscular injection, very similar to the influenza vaccine that we currently have all received or available from in an annual basis.
Great, thank you, Scott. How many doses are required of the vaccine?
Currently, both the vaccinations are a two-dose sequence to completion of the COVID-19 vaccine.
Okay, so now that we know it's two doses, how often do they have to be administered?
The CDC, which is Center for Disease Control, has not issued any recommendations on how often we should be vaccinated. What we will do is work with their recommendations in the current aspect of what that protocol will exactly look like into the future in that.
Great, thank you, Scott, for those details on what we know about the vaccination at this time. Turning our focus now to patients and residents, Ryan, is there a consent form to get the COVID-19 vaccine at this time?
Yeah, the consent forms have been and are currently being distributed. Residents and representatives will need to sign to authorize and give us consent before we can give any COVID vaccines.
Great, Ryan. Can a resident or representative decline the vaccination?
Yeah, anybody can always decline. It's not something that we're going to make anybody take. And so there is a declination form that we would just ask that people fill out so that we can ensure that it has been offered.
All right, so what if we decide to sign this declination form? What happens when it is declined?
So the vaccine is only part of the pandemic, a part of combating the pandemic. Unfortunately, we're not going to see vaccines happen and this disappear. So the CDC is going to recommend that we continue using PPE even with the vaccine. And then for those that do choose to decline the vaccine, right now what we anticipate is that there would be an extended PPE usage, PPE being a personal protective device. So that's where we're looking at our eye protection and our masking.
Ryan, great. Thank you for the details. Scott, another very popular question has been around side effects. Are there side effects related to the COVID-19 vaccination?
Certainly, that's a great question. With any medication, and essentially a vaccination is a form of medication, there are risks of side effects. What we've seen so far with clinical trials that have been completed is a very similar side effect profile to the flu vaccine as far as the side effects that patients are getting. And so the hindrance of the safety concerns about this is much less than the benefits.
Great, thank you, Scott. What if we have a resident is ill or a staff member? Will they still be given the COVID-19 vaccine?
Currently, our recommendation is to hold off on giving that patient the vaccination if they have a fever or illness at that time. That doesn't mean that they can't receive the vaccine, but it would be just at a future date.
Great. Another common question out there is cost. Is there a cost associated to receiving the vaccine at this time?
So currently, the cost of the vaccine would be covered by the federal government and what we've purchased as a nation. The only thing that there would be a potential cost for that we would gather insurance information is for the administration of it.
All right, Scott, thank you for the details around the side effects and the cost. Tim, another question that has been popular in the media is, what is the process for determining what residents, patients, or staff will be eligible for the COVID-19 vaccine?
Well, NCHC is currently working closely with Wisconsin DHS and will proceed using the Phase 1A allocation approach. So with COVID-19 vaccinations, they will be available for administration to residents, patients, employees, pending availability, and through a phased approach due to patient population. Right now, North Central has created a phased approach to support future implementation for all healthcare staff as well.
Great, Tim. Thank you for that information on the phasing. Who is actually providing the COVID-19 vaccinations?
Actually, we're partnering, North Central has been partnered with Walgreens Pharmacy to administer the COVID vaccines to residents and staff. This is a program organized through the state of Wisconsin Department of Health Services. Right now, North Central will be working in collaboration with our local health departments to determine the vaccine rationing.
Great. Thank you, Tim. Another popular question has been, if a resident or staff has already tested positive for COVID-19, do they still have to get the vaccine?
Right now, there is not enough information currently available to say if or for how long after the infection someone is protected from getting COVID-19 again. This is called actually natural immunity. Early evidence suggests natural immunity from COVID-19 may not last very long, but most studies are needed to better understand it. The CDC has not issued recommendations on whether people who had COVID-19 should get a COVID-19 vaccine, but North Central recommends that all residents receive the COVID-19 vaccine.
Great, thank you, Tim. All right, we're down to our final three questions for today, and those will go to Ryan and Scott. So starting out with Ryan, do residents need to continue to wear masks after they've completed both doses of the COVID-19 vaccination?
Yeah, as we discussed a little bit above, even with the vaccine in place, enhanced precautions regarding COVID. As the experts learn more about COVID-19 vaccines in a real world environment, it'll be important that we continue using the other tools available to us to help stop the pandemic. Again, I think it's important to note that the vaccine itself is not going to end, everything COVID related. We're still going to have masks. We're still going to be doing social distancing, which includes the staying 6 feet away from each other as much as possible. There's just simply not enough information currently available that CDC or other experts would remove those precautions at this time.
Great, thank you, Ryan. Moving ahead then, will visitors be able to come to the locations or the sites after they're vaccinated?
So currently we do allow restricted visitation under certain circumstances. And of course, there's screening involved there. It is too early to tell what effect the vaccine will have on removing some of those visitation restrictions. This is something that we will continue to monitor as the vaccination program progresses, and we will continue to follow CDC recommendations regarding visitation.
All right, thank you. This brings us to our final question for the day, which is for Scott. Where would be the best location to find sources for information related to COVID-19 vaccination?
So North Central Healthcare receives our information from the Center for Disease Control, and we would strongly encourage the public to do so as well. Information from other sources, such as social media, may not be as up-to-date or as accurate and may lead to misinformation. We would recommend visiting the CDC's website, and we can share that link from that standpoint.
Scott, great. Thank you for providing those resources and information related to the COVID-19 vaccine. And I just want to do a special thank you to the three of you for joining me today and being able to provide this information to residents, staff, and families at North Central Healthcare. If you have any further questions or information, please go to our website at www.norcen.org. And again, I just want to say thank you for watching.